Right. So if you have read and understood, considering its communication skills station, please begin.
Okay. Good evening, sir. I'm Dr. Aya. I'm one of the surgical doctors in this department. I have heard my consultant told me that you have some concerns about your warfarin stop before the operation. Can you tell me about your worries?
Yes, Dr. Aya. Someone, I think the consultant told me that I should stop my pills of warfarin, and my own doctor told me that you should never stop this. This is threatening your life to stop the spell. Now you want to kill me by stopping the spells?
All right. First, let me explain to you what's warfarin and how it acts in your body. Warfarin is a medication that thins your blood to prevent some chemicals from making it clotted. And in your case, it's given for you because you have an artificial valve, so we don't want a clot on your valve. But so if we stopped warfarin, we will not leave you without anything. We will give you an alternative, which is an injectable and named heparin. This heparin will give the same effect of warfarin, only the difference that warfarin will stay in your blood for 5 days, while the other one can be stopped 12 days before the operation.
Okay, that you know, and you said to me that I have artificial valve, and my warfarin is protect this valve from blocked. Now you
Yes.
tell me that, oh, stop this warfarin. Are you sure that called like heparin will are you sure this will work?
Yes,
What's
yes, it works the same like warfarin.
what's the difference between and that?
Yes. So warfarin, the effect of warfarin stays in blood for 5 days, while the other one have short acting time that will stay only for 12 days in your blood.
So I need to be hospitalized before my surgery just to take what is called heparin?
Yes, you have to be hospitalized to take heparin.
I can't take it at home.
No, because it's injectable and you need someone to give it to you. So no, you can't do it. Unless we arrange it with some community nurse to give it to you.
So for how long I will discontinue my warfarin when I can resume my warfarin?
After surgery?
Yes.
Okay, after surgery, when we are sure there is no more bleeding and there is satisfactory results of your surgery, you can resume your warfarin, but not alone. We can continue giving you this heparin till 5 days after surgery. And after a blood test shows that the warfarin is giving the wanted effect, we can stop the heparin and you can continue with your warfarin.
So after surgery, you said that I can take warfarin and heparin together?
Yes, you have to take them together, only for maybe 5 days.
Do you think this is much blood thinner? I'm afraid that I may be go through bleeding risk.
No, this will not happen because the warfarin action will be more longer time. It takes more longer time to be to give the action in your blood. So this time will be given by heparin.
Okay, and some regarding some bills of anxiety I took. What about them? Should I stop them either?
No, you don't have to stop them. And even in your operation, you have to take in the morning, early morning, with a sip of water.
Okay, doctor. Uh, Thank you. I can shift to what's called heparin. Thank you.
You're welcome. And if you have any concerns or any question, you can ask me. Thank you.
Okay, just summarize up the case for me, please.
Okay, you are on warfarin because of your artificial valve, and we are planning to operate on you. So the warfarin will cause bleeding in surgery. To avoid this, we're gonna stop your warfarin 5 days prior to surgery and replace it with a heparin. that will have a shorter action. We can stop it 12 days before the operation. And after the operation, when everything is good and there is no bleeding from any place, we can continue with your warfarin and heparin.
Okay, thank you.
You still have almost 3 minutes left. So this patient is legally blind, okay? How would you address the patient? How would you make sure that you're saying hello to the patient and patient realizes that you're talking to the patient? How would you make sure? Yes,
I can maybe tap on his shoulder.
maybe not.
Mm.
What should be the best way to address him? A legally blind patient. And patient, what if patient is really stubborn, does not want to stop warfarin? How would you convince the patient? Because we still have time, so we can discuss this. If patient says, my cardiologist said to me that you will stop breathing if you'll stop taking warfarin. So by no chance I can stop taking warfarin. I cannot stop it. What would you say?
I think we can arrange even with his cardiologist.
No. How would you convince him? What would you say? Why your cardiologist said that?
Yeah.
Please explain. How would you convince? What would you say?
So his cardiologist told him that he can't breathe?
Just say, or you'll die if you'll stop taking warfarin. So I cannot stop taking warfarin. I must take it because I have to live.
So I will tell him no.
Yes,
The
no.
important for the warfarin is important for your blood because it's thinning it. So we are not leaving you without it. We are just giving you an alternative that will take a shorter time in your blood.
Okay. And
be appropriate for the surgery. And once you are okay, you can you can go back to it again.
yes. So you have to reassure the patient that only for few days, because of this procedure that you're taking or going through. So just for the sake of this procedure, you will be stopping it. You won't be stopping it forever. It's just like temporary, you're holding it back. Okay, good.
Yeah.
And even the time shortage one, you have to make sure that you explain it to the patient very nicely, that warfarin takes longer time to thinner your blood in the circulation, takes longer time. And this injectable, it takes shorter time. That's why during the surgery, we have to give you, or we have to switch it over to this one. So you have to use the vocabulary and the words and the terminology so the patient can easily understand.
Yeah.
Right. What more you can do? Patient is legally blind. You can ask the patient if he's being bothered by the light, or is that okay? Otherwise, you can turn it off. Okay. Because blinds cannot see literally, but maybe sometimes, okay, light can be a problem, or they want you to, or you can just ask in a sense to get the attraction from the patient so that patient will understand you're talking to him.
How can I do this? I am always having
without
problem.
touching him. How would
Without
you do
touching
it?
the patient, right?
Yes.
Because some people are saying that you should tap on his shoulder.
No, it's by no means you have to touch the patient unless you're examining. And if you're examining the patient, then you have to take the consent. Can I examine you? Is that all right?
Exactly.
If I examine you, without consent, you can't even touch the patient. So I'm asking you, tell me, how would you gain the attention of the patient?
So we can ask him about the light. I can dim
Yes.
the light. It's
You
light
can
for
ask
you.
him, is that all right, or is it bothering you? So that in that way, patient will realize or notice that someone is talking to him. Okay, good.
Okay.
But it's